Hello, my name is Tracie Price, and I've been a nurse at SSM Health St. Hospital in Maryville for almost 20 years. First, I want to express how wonderful it is to speak with all of you about the amazing people at SSM Health St. Francis Hospital and Medical Group in Maryville. My family and I have been blessed by the people that work there, and I'm thankful for the opportunity to express why I feel that way. On June 2nd, 2016, my youngest son, Maverick, was a passenger involved in an automobile accident. He was badly injured and was brought to St. Francis by ambulance. I was totally amazed on how everyone in the hospital responded to the accident and my son and his friend. I was working in the clinic downstairs, and Deb Hoffman, Vice President of Patient Services and Director of Nursing, came down and told me there'd been an accident, and she took me to be with my son. They called Dr. Terry Simmons, who is one of our primary care physicians and the emergency service director, to come up to ER to help with the two boys coming in. When I got to my son, Dr. Thomas Carter and staff were already on the phones to get both boys transferred to Children's Mercy Hospital in Kansas City due to the extent of their trauma. Dr. Carter asked me if my son's chest was normal. I said no. He had an indentation in his chest, and the left side was higher and larger. Maverick's left lung was shoved clear up and over towards the right lung, and his diaphragm was where his left lung should be. Chaplain David Robertson, the police officers, ambulance crew, and several members of the hospital staff all asked if there was anything they could do for me. There came a point where I realized that I did not have my phone so I could call my husband Jim to inform him Maverick had been in a bad accident. Someone went downstairs and got it for me, so I did not have to leave my son's side. When they brought me my phone, they all offered to help make calls to whoever I needed. I moved to the head of my son to talk to him while waiting on his dad to get there, and I also did this kind of just to get out of the way. Dr. Carter came in and he said, "We need to put a chest tube in." I said, "Okay, give me a set of gloves and I'll help you." I really was just trying to keep my son calm and make the mood in the room a little lighter, but I remember Dr. Carter looking at me and saying, "Tracie, why don't you just be mom today and not the nurse?" It brought tears to my eyes, so I just leaned down and kissed my son. When I looked up, I saw Dr. Simmons at the end of the bed. He came in to see if he could help. I also saw Dr. Sally Belmar, Michael Fearbacher come up to check to see if they could help with anything, along with other nurses and from other areas of the hospital. I also saw how wonderful our x-ray staff and our respiratory staff are. I know I'm missing people, but you have to know that while I was looking around, I was calm the whole entire time, knowing that my son was in the best hands I could ask for. Like I said, I've been working there for almost 20 years. This was the first time I'd ever seen two live flight helicopters land at the same time to get both boys out to Children's Hospital. My son's injuries included breaking all 24 ribs, a collapsed lung, a broken clavicle, a small fracture in his pelvis. His diaphragm was ripped only 1 millimeter from an artery. So if it went 1 more millimeter, he'd been in heaven today. My son was lucky. He spent a little over 7 days in the hospital. Today, when you see him, you'd never know he was on death's door. This is my son, Maverick Price. I was blessed to have the amazing staff at SSM Health St. Francis there to save my son's life and to take care of me and my family through this crisis. During the time I was down at Children's Mercy Hospital and off work with Maverick, the staff at SSM Health made sure my family at home had food, and I had extra clothes in the hospital since I did not leave my son's side. So you can really see why I am so grateful for the wonderful family at SSM Health. 7 months from the day I brought my son Maverick home from the hospital the final time. On January 14, 2017, I lost my oldest son, Michael John Ogle, in an automobile accident due to icy roads. I was at another hospital with my husband's uncle when I got the call that my son Michael had been in an accident and he did not survive. The incredible thing is that when I finally got a hold of a coworker, she made contact with Melinda Dennis, a nurse, a coworker, who happened to be at the same hospital as me. Melinda came down to sit with me until my family got there to take me home. She was there because her mother was also very sick. She said the most important words to me that day I always hold real dear to my heart. She said, "Tracie, I just want you to know that Michael will be very well taken care of very soon, because my mom, Joyce Ike, will be there to take care of him. And together they'll take care of us." She held on to me and we just cried. When I finally got home to my house that day, several coworkers had brought food and supplies and were there for me and my family. Every day after that, one of my coworkers, Rachel Rush, Natalie Hall, Linda Sharp, and several others called every single day to make sure to see how I was doing. I also was blessed by a friend and nurse practitioner, Martha Mushton. She took time from her busy day to come with me to view my son and be my supporter at the funeral home. I needed to see my son one more time. Thanks to Martha, I did not have to do that all alone. She is amazing. All of my coworkers and several of the providers come to my son's visitation. I cannot tell you how that made me feel to know each and every one of my coworkers cared enough to be my support during the hardest time of my life.